Let's examine the structure of the diaphragm. The diaphragm is a muscle tendon structure separating the thoracic cavity from the abdominal cavity and is classified as a respiratory muscle. The diaphragm has a domed shape with a convex surface facing the thoracic cavity and a concave one facing the abdominal cavity. The center of the diaphragm has a structure of connective tissue and is called the central tendon.
Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description.
The diaphragm forms two domes. The left dome is located at the level of the fifth intercostal space. The right dome is located at the fourth intercostal space. There are three parts of the diaphragm. The beginning of the lumbar part is described in more detail below. The costal part, which starts from the inner surface of the ribs 7 to 12. The sternal part, which arises from the posterior surface of the xiphoid process of the sternum. The lumbar part arises from the first to third, sometimes fourth, lumbar vertebrae with two crura, the left crus and the right crus, and also from the following ligaments: the lateral arcuate ligament, the medial arcuate ligament, the median arcuate ligament, and the anterior longitudinal ligament. The ligaments are intertwined in various ways, as a result of which several hiatuses are formed. The aortic hiatus, in which the aorta and thoracic lymph duct pass. Here, the median arcuate ligament protects the aorta from compression during the contraction of the diaphragm. The esophageal hiatus is where the esophagus and the vagus nerves pass. At this site, the diaphragm performs the function of the esophageal sphincter of sorts. However, this site is also called a weak spot, where hernias may form. There are two structures in the area of the central tendon: the cardiac impression and the opening of the inferior vena cava. Between the parts of the diaphragm, there are regions devoid of muscle fibers. They are called triangles of the diaphragm. These are also weak spots where hernias often form. The lumbocostal triangle, Bogdalec's triangle. The sternocostal triangle, on the right, Morgani's triangle, on the left, Loray's triangle. The diaphragm is the primary respiratory muscle. During inhalation, it flattens, due to which the volume of the thoracic cavity increases. During exhalation, on the contrary, it becomes convex, reducing the volume of the thoracic cavity. In addition, the diaphragm participates in increasing intra-abdominal pressure during various physiological processes, including blood circulation, defecation, urination, childbirth, and lymph drainage.